Hello, everyone. This is our review for the exam 6 for dental science, and it is about microbiology. It is part of a different book, which is infection control and management of that for the dental team, but um, we picked just a few things out of it, so I think this would be more than enough for our purposes. So, first, we start with some definitions. Generally, microbiology is the studying of living life forms. It's the microorganisms, so small life forms. And most probably, you're all kind of familiar with the concepts anyway. These are definitions. Definitely read the definitions and know them. Part of the history that we want to mention maybe is the Louis Pasteur is the scientist that was able to prove that bacteria causes diseases and found that heat destroyed bacteria, and that's where we got pasteurization from, based on his name. Um, so more about microorganisms. So they're too small to be seen with naked eye. They're normally found. So all of us have some kind of microorganisms in our body, in our mouth. A lot of them can be beneficial for us. So some of these benefits, like bacteria, can help in digestion, clean oil spills, pickle, cultured dairy, yeast can ferment wine, beer, or make the bread rise. Bacteria and yeast together can synthesize the insulin. So, and some vaccinations. So these are helpful things with microorganisms. We have five major groups. We'll be talking about bacteria, fungi, and viruses. So bacteria. Um, the ideal growth conditions for bacteria would be warm, dark, some food and some moist. These are the most best conditions for bacteria to grow. We do things to identify what bacteria it is. So sometimes, like the patient would have some kind of infection, or even like a pus, or a periapical infection, and we need to know what bacteria it is so we can treat it in the right way, especially if it wasn't treated with the regular work that we have. So what we do to identify the bacteria, we would take a sample, we send it to the lab, and the lab would do a couple of things to be able to recognize it. One of the most used tests are staining tests, and we have a dye which we call gram dye. The dye name is gram, actually. So if the bacteria is gram positive, it will be colored blue or purple. And if the bacteria gram negative, so it technically did not die, it will be pink or red. And based on, if we know that it is gram positive, so we'll know it's part of the specific bacteria category. And if it's gram negative, we can know that it's part of the other category. So this is a way for us to be able to identify the bacteria. Another way to identify bacteria is by the bacteria's shape. So you need to know each one of these and its shape, and I will show you maybe a way that will be a little bit easy to recognize. So like Bacilli is rod. So like you can see, the name of Bacilli is all like rod shape, I and L and I. Cocci is round, and you can see it's all rounded things, right? So that's how I usually remember them. And spirilla, from the spirilla, right? It's like S shape. Diplococci, so di, that's both like double, right? So it's always, that's in pairs. Well, these on you, so staphylococci are clusters, and streptococci are chain. And this is how they appear under the microscope, and how we can again recognize them to be able to know what bacteria we're working with. Just some pictures for reference. So one of the things that bacteria can do is bacterial spores. So we know we can kill bacteria regularly with some disinfectants and some other things. We can usually kill bacteria, but in the same time, bacteria can actually protect itself with a wall around the cell. And when it does that, we call it a bacterial spore. So these are one of the most resistant to heat, drying, and chemical. They can lay dormant for years, so they can be technically alive, but they're inactive. They can stay for years and years as long as they have that wall around them, and it's amazing. that you cannot technically kill them. You can only kill them with the ways that we'll talk about a little bit later, with autoclave or dry heat. And that's mainly one of the main reasons why we use autoclaves, other than killing viruses, but also to kill bacterial spores. And you can see that on some of the disinfection solutions. You can see if they kill the bacterial spore or not, or how long it needs to kill bacterial spores. Sometimes, for chemical sterilization, it will require about 12 hours to be able to kill the spores. Anyway, so these are the bacterial spores. They remain dormant for years, and they become active later on when the conditions are good. Things that we can do to control bacteria, usually, again, to kill the spores, you need high temperature and steam or dry heat or chemical vapor. Bactericidal agents are the ones that can kill. Again, bactericidal, like from cidal, I guess. And bacteriostatic are the ones that can stop the growth of the bacteria but without killing it. So there are two types of agents. It can either stop it, technically antibiotics, so they can be either kill it, and then that means that it's dead, or it can stop the growth of it, and then it will, the body can help work on them and kill the rest of them. Anyway, these are the two types of the agents that can work on bacteria. Bacterial diseases, there are a lot of bacterial diseases. I want you to know these. Make sure that you know what things. I picked some of these as bacterial diseases. Mutant streptococci, this is the bacteria that is the most important one for us in dentistry, because it's the most carries conductive bacteria. We talked about that before in preventive, but that's the most the main bacteria that actually can cause the caries. Okay, viruses. So viruses are smaller than bacteria, and they're usually bloodborne. They cannot live outside of the body. Usually they need a host to live in. They cannot usually live outside for long times. They're capable of changing, and they are not affected by antibiotics, again, because antibiotics for bacteria. This is, I guess, technically this is how the virus actually look like in a way. It has a head and it has like a sheet, but it's mainly a DNA material, and then it's just when it gets to the body, it injects it in it and let the body do the replication for the virus, and that's how it will replicate. So to kill viruses, usually, viruses are technically, we cannot really kill them directly, and that's, now with coronavirus you can see, but usually we work on the symptoms more than anything else with viruses. There are some antiviral products, but usually we work on the symptoms of the virus. But to kill them, we can use one of these three ways. So we can boil for 20 minutes, except hepatitis would not, be affected with that. Autoclave, I want you to know these and memorize these. So autoclaves, you need 15 to 20 minutes at 250 to 270 Fahrenheit. Dry heat, 1 hour at 320 or to 350 Fahrenheit. So these are the three ways to kill viruses. You need to know the timing and the temperature for these. And again, these are some diseases that are caused by viruses. Most probably you know all of them already, but again, you have to differentiate between the ones that are caused by bacteria and the ones that are caused by viruses. Some just examples. Fungi is the other type of microorganisms that we're talking about. So fungi is considered opportunistic, which means it is an infection that happens only when the body immune system is weak. So you see, like, if you have too many antibiotics, or you have immunodeficiency like AIDS, that's when usually these other type of opportunistic infections work. But fungi is the one that is opportunistic, so it is the infection that usually happen when the body have a weak immune system. With a regular human being, you might have it, but it will not cause the infection. Fungi include yeast and molds. They can have different types of infections, and it's treated by topical antifungal agents. One of the things that we can see in the oral cavity is candidiasis, which is caused by Candida albicans. And you can see this is how it looked like: white to creamy yellowish cottage cheese looks, raised patches. It can be in the mouth or the vaginal vaginal areas, and then it also called thrush. That's also what it can be called. Um, so now we're talking about the infection and prevention of the infection. So infections can be either endogenous or exogenous. From the name, endogenous are the microorganisms that usually in the body, and exogenous is something that we contaminate the body from outside. So we have the chain of infection that we'll talk about in the next slide, but technically this is the chain how the virus or how the infection goes from one person to another, the cycle that continues the spread of the virus. And again, now with the coronavirus, we're more kind of aware of these things. But technically, definitely you need an infectious agent, so like a virus or a bacteria or whatever, a reservoir that can holds the virus in, and then a portal of exit. That's how it transports from the host, maybe technically, to another person. And you need a mode of spread, and you need how it will spread from that portal of exit to the other person, and then you need a portal of entry to the new host, and then definitely the actual host. We'll see that in the next slide. So if you break any of these, because that's what we call chain of infection. So if you break one chain of that, you can prevent the infection. And that's why, like, we can say, we need to wash our hands. That's one of the things that we can do to stop the mode of spread, right? Or we can wear masks also to stop the portal of exit, so that the virus would not exit our body. Or we wear goggles so that we stop the portal of entry. So all of these things, and definitely staying healthy, that's with the host. All these things that we can do, any of these, if we break any chain of these, then we can break the infection cycle. So definitely we need to follow those standard precautions, and standard precautions means universal and body substance isolation. The universal precautions, which means you have to treat any blood or any other body fluids as potentially infectious. So whenever you work with patients, you work with them as technically as if they are infected. You have to take concentration, and you have to take infection control practices as if the patient has a virus or infected. That's how this would give us a standard to work with, and get us to be more specific about our infection control practices. So that's what universal precautions mean. And also the body substance isolation to reduce the risk of transmission of body from most body surfaces. And that's what standard precaution stands for, both of these two. This is the chain of infection that I was talking about. So infectious agents, so virus or bacteria. Reservoir can be the bodily fluids, water, feces, insects, or animals. Anything can be a reservoir. Portal of exit can be secretions, excretions, droplets, aerosols. The mode of spread, so it can be direct, indirect, droplets, or aerosol, which we'll talk about. Portal of entry, it can be inhalation, ingestion, mucous membrane, or break-in skin. So the airborne can go through the mouth, the nose, or eyes. The bloodborne through the skin. A susceptible host, the person who is unable to resist. And again, a poor health, a fatigue, stressed person will become more likely to be infected. These are the bodily fluids, or sample of the bodily fluids. So you have to know these. So this is the chain, and again you can see what each one means. You don't need to memorize this. This is just for reference, but again, I think it provides good thing. And these are the ways that we can break one of these, like how to break this chain, and how to break each one of these chains. And again, if we break any one of them, we can stop the spread of infection. Okay, so we talked about the mode of spread and the route of entry, but we'll just go a little bit more deeper. So direct, that's by touching the patient directly, the teeth, lesions, and these are the disease that can happen for each one of the modes of the spreads. You don't need to memorize these. These are just examples for you. Anyway, so direct is the direct contact. The indirect, you touch contaminated instrument, maybe with a patient, and you get the disease. Droplets and aerosol. So droplets are bigger. When we say bigger, it's just bigger than 5 microns. And usually the droplets are transmitted by close contact. Aerosol, on the other hand, they are smaller and they can remain airborne for hours after we do the work. And again, we have a lot of both of these in our work in dentistry because of all of the water and aerosols and mist that we have, all of these. And definitely parenteral is part of spread of the disease from the mother to the child. The ports or routes of entry, so you have inhalation, definitely breathing in, ingestion through the mouth, mucous membrane through the eyes, nose, or mouth, and breaks in the skin. That's with a sharp injury, most probably, or if you have an open skin cut. The stages of the disease infection, so we have 4 stages of infectious disease. You have incubation, primordial, and acute, and convalescence. So the incubation, that's from the first entry of the disease to the appearance of the first symptom. And then prodromal. These are when you see the early symptoms, and they sometimes they call it malaise, which is not feeling well, and these are the symptoms that you can have. Acute, that's when you have the maximum of symptoms, like the most, and that's usually that would be obviously ill. Convalescence, that's the recovery stage, and the disease can still spread within these areas. Some people will even carry it after they are completely healthy. They'll be a carrier of the disease. So there are different things that the host can do defense the diseases. So definitely the immunity. Fever is one of the defense mechanisms, and these are, because bacteria cannot survive for high temperature for fever, so the body would activate the fever technically to get the bacteria to die, and that's why we shiver sometimes, even though that we have fever, so that the body can produce, or the muscles when they shiver can produce more heat, and by creating heat we can kill the bacteria. Inflammation, which is the increase of blood flow to the injured area, can also be part of the defense mechanism, because now the blood would have the healing cells in it and the defense cells in it, and by having the blood into the area, that will make it we can defend the body more. We have these cardinal signs of inflammation. So there are 4 cardinal signs of inflammation. You have erythema, which is redness, heat, edema, which is swelling, and pain. And technically, this is what you have. Maybe if you have any kind of infection, any kind of you'll see that there will be redness in the area. There will be heat because of the blood. Most of these are because of the blood circulation is increased in the area. So you have more redness. You have heat, edema, and pain because of the pressure on the nerve endings. And this would end our review for this chapter.